Hey guys, thanks for stopping in. Cold out here today. So, got me thinking, I don't know if I've made any videos about fibromyalgia. I know that I talk about it sometimes, but mainly my videos are about thoracic outlet syndrome, which I have, or chronic pain or lower back pain. I recently had a double spinal fusion surgery. That's my third back surgery, but I've also been told that I have fibromyalgia or chronic myofascial pain syndrome, something like that. So I just thought I'd give you kind of my opinion of what I think fibromyalgia is in my case anyway. I've had thoracic outlet syndrome. I'm 55 years old right now, and I've had thoracic outlet syndrome since I was, I don't know, I think it started having symptoms when I was around 18 years old or so. So a lot of years. And over time, I gradually got tighter and tighter and stiffer and more pain. And I think in my case, it's the fibromyalgia is caused by tight fascia. If you don't know what fascia is, it's you have your individual muscles throughout the body, and then, you know, wrapped around that and kind of all in between it is fascia. It's kind of like a web-like substance, kind of almost looks like spider webs if you look at it. But I think what happens when you're in pain a lot all the time, like with me, your muscles are tight all the time, and over a lot of years, in my case, where you don't move them, they don't get any fluids and any nutrition into them. So that fascia gets all tight, and it gets hard, and it gets kind of bound together, and it binds all your individual muscles together. So you have all these individual muscles that are supposed to slide across each other like this and all work freely, where they kind of get all stuck together. And then when you do much or move around much, it causes pain and inflammation. And I'm pretty sure that's what happened in my case, because in the last 7.5 years, I found 3 things to help me. Joint mobility exercises like this. You can Google it, but that one by Steve Maxwell, that's a good series of joint mobility exercises. Self-massage and vacuum cupping, where you put the suction cups on like the Olympians do, and that really helps loosen up tight fascia for me, along with self-massage. And actually, I've used a lot of different massage tools, and this is my current favorite. I have 2 of these. This is called a fascia blaster. This is a large size one, but I also have a smaller one as well. But what you do with these, you put some oil on your skin, and you massage the muscles with it, and it helps kind of loosen them up and kind of breaks up the fascia that, you know, that covers the muscles, softens it up, and over time it's really helped me to loosen up a bit. So those are the 3 things that have really helped me. Now, I have seen people who say nutrition, changing their nutrition, or you know, cutting out certain foods or adding certain foods or supplements or this or that has helped them. And I've tried all that, but I've never found anything that's really helped me as far as that goes. So as far as nutrition, actually I had my back surgery 6 months ago, and since then I've been eating a lot of plant-based foods. I still eat some meat, but one thing, I have lost about 35 pounds from eating a lot of plant-based foods. I eat a lot of potatoes, basically just cut them up and put just a little bit of oil on them and season them and bake them, and I eat those, and I've lost a lot of weight from eating potatoes. So if nothing else, it's the plant-based diet helps me lose weight. I don't know if it's helped with the pain any. That's kind of hard to say. I mean, unless you keep a close journal and real close tabs on what you eat, it's kind of hard to tell. Like I said, I've never really noticed much difference as far as food, but it's mainly the movement. The more I move, the better I feel, but up to a point. I have to just do a little at a time and increase things a little at a time. And I also have to realize that I'll never be you know, normal. So I'm always going to have limitations, and I've learned to just, you know, accept that, and rather than think, okay, it's all or nothing. If I can't do everything a normal person can do, I'm not even going to try to do any exercise or anything. You just have to learn to do what you can tolerate. When I first started, you know, exercising, doing the joint mobility exercises, I just started with one exercise, and even that caused a lot of pain and inflammation later in the day. And then over time, I gradually add one more, and just a little at a time, where if you go to therapy, they'll, you know, throw 10 exercises at you all at once, and it's like just way too much, and then you flare up, and then you think you can't do any of it, and really they're just pushing you way too hard, way too fast. You got to take tiny baby steps and just keep at it over time. I've been working at this 7.5 years now, and still, if I, you know, try something new or try to do too much, I'll still get flare-ups and setbacks. So it's just, it's a constant, like, it's a marathon, it's not a sprint. It's something you have to stick with over time. I've been in forums and stuff for people with thoracic outlet syndrome, and the people I've seen do pretty well seem to be people who do a lot of self-care, and they do a lot of experimenting, and they find the things that work, and they just do a little bit of it, and they stick with it. That's the main thing. My wife has chronic pain issues, and she won't stick with anything. She'll, you know, do a little this, a little that, do it for a few days, or even some of the stuff I do, she'll try it, makes her hurt more, and she's like, I can't do it. And she's gradually getting worse over time. I'm gradually getting better. So a lot of it is all just in your head and how you approach things. So that is my video for today. Thanks for watching, you guys, and I'll talk to you next time.